3 years ago, I watched a 58-year-old woman die in front of me because of something she did every single morning for the past decade, something she thought was completely harmless, something her own doctor had never warned her about, something that, statistically speaking, you are probably doing right now as you're listening to this. My name is Dr. William Lee, and in my 22 years practicing cardiovascular medicine, I have never been more disturbed by a single case than this one, because Margaret wasn't a smoker. She wasn't overweight. She didn't have diabetes. Her cholesterol was borderline but manageable with diet. On paper, she was one of the healthiest 58-year-old women I had seen in my clinic that entire year. She came in for what she called a routine checkup. She sat across from me in my office, smiling, telling me about her grandchildren, telling me about the garden she was planning for spring, telling me she felt better than she had in years. And 47 minutes later, she was on the floor of my waiting room, unresponsive, her lips already turning that terrible shade of grayish blue that every cardiologist recognizes instantly. My nurse called the code. We started CPR within seconds. We had a defibrillator on her chest within a minute. We did everything right, everything by the book, everything my training and 22 years of experience had prepared me for. She died anyway. And when I sat down with her husband later that afternoon, in the small family room off the ICU, this man who had just lost his wife of 34 years, he asked me a question I will never forget for the rest of my life. He looked at me with red, swollen eyes and he said, "Doctor, was there anything at all she could have done differently this morning?" I couldn't answer him honestly in that moment. I told him what cardiologists are trained to tell grieving families. I told him about genetics, about silent disease, about how sometimes these things happen without warning. But I was lying. Not deliberately, not maliciously, but because I didn't know yet what I know now. Because I hadn't yet spent the next 18 months of my life obsessively investigating what actually happens to the human cardiovascular system in the first 60 minutes after waking up. And what I discovered during that investigation, what the research shows, what the data screams at anyone willing to look at it honestly, changed how I practice medicine forever. Before I go any further, I need you to do something for me right now. In the comments below this video, I want you to write down the very first thing you did this morning after opening your eyes. Not what you wish you had done, not what you think a healthy person would do, what you actually did in those first 5 minutes. Be honest, because by the end of this video, you're going to understand why that answer might be the most important piece of information about your health that you have never shared with your doctor. Margaret's husband told me exactly what she did that morning. He walked me through it minute by minute because he needed to understand. He needed something to hold on to. And as he described her routine, that beautiful, ordinary, seemingly healthy morning routine, I felt the blood drain from my face because I recognized every single element. I had seen this exact pattern in the medical histories of patient after patient who had suffered sudden cardiac events in the morning hours. I had just never connected the dots before. That night, I went home and I couldn't sleep. I sat at my kitchen table until 3 a.m. going through every case file I could remember of morning cardiac events in patients over 55. And a pattern emerged that was so clear, so undeniable, so terrifying, that I knew I had a moral obligation to spend the rest of my career warning people about it. If you are over 55, or if you love someone who is over 55, I am begging you to subscribe to this channel before I go one word further. Click that subscribe button right now, because I'm about to share information that the person you love, your mother, your father, your spouse, your best friend, needs to hear. And if you don't subscribe, if you don't help this video reach the people who need it, the algorithm will bury it. And the next Margaret will die in someone else's waiting room. Your subscription is not for me, it's for them. Let me explain what actually happens inside your body in the first hour after you wake up, because once you understand this, everything else I'm about to tell you will hit you with a force that will make you rethink your entire morning routine. When you wake up, your body does not gradually transition from sleep to wakefulness like a dimmer switch slowly brightening a room. Your body detonates into wakefulness. Within the first 30 minutes after opening your eyes, your cortisol levels surge by up to 75%. This is not a gentle nudge. This is your endocrine system firing a massive dose of stress hormone into your bloodstream to force your body from a state of restoration into a state of readiness. At the same time, your sympathetic nervous system, the fight or flight branch, seizes control from the parasympathetic system that was managing your body during sleep. Adrenaline floods your circulation, your heart rate accelerates, your blood vessels constrict, your blood pressure climbs by 20 to 30 points in some individuals, sometimes even more in people with underlying hypertension. And here is what almost no one tells you. After 7 or 8 hours without any fluid intake, your blood has physically thickened. The plasma volume has decreased, the concentration of red blood cells and platelets has increased. Your blood, at the moment you open your eyes, is measurably more viscous, measurably stickier, measurably more prone to forming the exact clots that cause heart attacks and strokes than at any other point in your 24-hour cycle. Now hold that image in your mind. Blood that is thickened overnight, a heart being forced into overdrive by cortisol and adrenaline, blood vessels that are already constricted and elevated in pressure, arteries that, if you are over 55, have naturally lost some of the elasticity they had at 25. This is the state your cardiovascular system is in the moment you become conscious. This is what doctors call the morning danger window. And it is not theoretical. The statistics are staggering, and they have been sitting in cardiovascular research journals for decades, largely ignored by the general public. Heart attacks are 40% more likely to occur between 6 a.m. and noon than at any other time of day. Sudden cardiac deaths peak in the same window. Ischemic strokes cluster in these hours, with a consistency that cardiologists have documented across every major country in the world. Your body is at its most vulnerable in the first hour after waking. And into this vulnerable window, millions of people every single morning introduce behaviors that they believe are healthy, disciplined, or simply routine. Behaviors that stack on top of the biological storm already raging inside them. Behaviors that, in a younger body, would be absorbed and forgotten, but in a body over 55, can be the final push that sends everything cascading into catastrophe. There are 5 specific morning behaviors that I have identified through my research as the most dangerous. Margaret was doing 4 of them. I want you to listen carefully to each one, and I want you to be brutally honest with yourself about which ones apply to you. The first behavior is the one that 84% of adults do without a second thought: getting out of bed the instant the alarm sounds. You hear that alarm, your eyes snap open, and within seconds you have swung your legs over the edge of the mattress and you are standing upright. It feels productive. It feels disciplined. It feels like what capable adults do. But for a cardiovascular system that is over 55 years old, this single movement can be genuinely lethal. Here is why. During the 7 or 8 hours you spent lying flat, your blood was distributed evenly throughout your body. Gravity was not pulling it in any particular direction. Your circulatory system reached a kind of equilibrium. The moment you stand up abruptly, gravity yanks approximately 700 to 800 milliliters of blood down into the veins of your legs and abdomen. That is nearly a full liter of your total blood volume relocating in a matter of seconds. Your heart, which was already dealing with the morning hormonal surge, suddenly has significantly less blood to pump upward to your brain. In a young person, pressure sensors in the neck, called baroreceptors, detect this drop instantly and signal the heart to compensate within milliseconds. The adjustment is so seamless you never notice it. But baroreceptors age just like every other tissue in your body. After 55, their response time slows, their sensitivity dulls. There is now a lag between the pressure drop and the compensatory response, and in that lag, your brain does not receive adequate oxygen, you feel dizzy, your vision darkens at the edges, your legs feel unstable. In the worst cases, you faint, and even if you don't faint, your body panics. It floods your system with a compensatory surge of adrenaline that whips your heart from struggling to overpumping in seconds. This violent oscillation from underperfusion to sudden hyperactivity is precisely the electrical instability that can trigger fatal arrhythmias in a heart that is already stressed by the morning cortisol storm. The correction is almost embarrassingly simple. When your alarm goes off, stay lying down for a full 60 seconds. Take slow, deep breaths. Then sit up on the edge of the bed and stay seated for another 60 seconds. Rotate your ankles, move your calves, let your circulation adjust. Only then do you stand up, and even then, slowly. 2 extra minutes. That is what stands between a normal morning and a fall, a fainting episode, or a cardiac event. In the comments right now, I want you to write yes or no. Do you jump out of bed the moment your alarm goes off? Be honest. This is between you and your health. The second behavior is one that Margaret did every single morning for at least 20 years, reaching for coffee before reaching for water. Most people, the moment they get vertical, head directly for the coffee maker. Or worse, they have a coffee maker programmed to have a fresh pot waiting for them. They pour a cup, they drink it, and only later, much later, sometimes not until midday, do they consume any actual water. Meanwhile, your blood is thick from 8 hours of dehydration. Your heart is straining to pump this thickened blood through constricted vessels, and you are pouring a powerful stimulant into a body that is already running on maximum sympathetic activation. Caffeine on an empty, dehydrated body hits differently than caffeine at any other time of day. With no food in your stomach to slow absorption, caffeine reaches peak blood concentration in 15 to 20 minutes, instead of the normal 45 to 60. It triggers an additional release of adrenaline on top of the morning surge that is already happening. It further constricts already constricted blood vessels. It can spike systolic blood pressure by an additional 15 to 20 points within 30 minutes of consumption. For a 30-year-old with elastic arteries and no cardiovascular risk factors, this is absorbed without incident. For a 60-year-old with even mild hypertension or undiagnosed coronary disease, this can be the trigger that ruptures an unstable atherosclerotic plaque and initiates a clot cascade that ends in myocardial infarction. I am not telling you to give up coffee. I love coffee. I drink coffee every morning, but I drink it after I have consumed at least 400 milliliters of room temperature water. I drink it after I have eaten something, even something small. I drink it after I have given my cardiovascular system at least 30 minutes to stabilize from the morning transition. That single change, water before coffee, food before caffeine, is not a lifestyle sacrifice. It is a life-preserving sequence. The third behavior is one that has become dangerously fashionable in the last decade, promoted by wellness influencers who genuinely do not understand what they are recommending to their older viewers. Cold showers or cold plunges immediately after waking. Margaret didn't do this one. But of the patients I have interviewed since her death who survived their morning cardiac events, nearly a third of them were doing exactly this. They had seen the videos. They had read the articles. They had convinced themselves that shocking their body with cold water first thing in the morning was the secret to longevity, energy, and metabolic health. And for some populations, in some contexts, there is legitimate research supporting cold exposure, but not first thing in the morning, and not for people over 55 with any degree of cardiovascular vulnerability. When cold water hits your skin, especially your torso and chest, your body interprets this as a life-threatening emergency. Thousands of peripheral blood vessels slam shut simultaneously in a process called massive vasoconstriction. All the blood that was flowing through those vessels is suddenly forced into a much smaller circulatory volume. Blood pressure can spike by 30 to 50 points in a matter of seconds. For older, less elastic arteries, this is like inflating an aging balloon at maximum pressure without warning. An unstable plaque in a coronary artery can rupture. A weakened cerebral vessel can burst. The heart, already being driven hard by morning cortisol and adrenaline, is now forced to pump against dramatically increased peripheral resistance. Oxygen demand can exceed supply, especially if there is silent coronary disease, which studies suggest is present in over 40% of adults over 60 who have never been diagnosed. Ventricular fibrillation can result. Sudden cardiac arrest can result. If you are over 55, please, I am asking you as a cardiologist who has spent his career trying to prevent exactly these events, do not take cold showers first thing in the morning. If you want cold exposure, wait at least 3 hours after waking. Introduce it gradually over weeks, not days. Start with your extremities, never your chest. And if you feel any palpitations, dizziness, or chest discomfort during cold exposure, stop immediately and see your doctor. Those are not signs of adaptation. Those are warnings. The fourth behavior is one I see constantly in patients who consider themselves committed to fitness. Intense exercise within the first hour of waking. Running, weightlifting, high-intensity interval training, spin classes, any activity that rapidly elevates heart rate and blood pressure during the exact window when your cardiovascular system is already at maximum stress. Exercise is one of the most powerful protective factors for cardiovascular health. I want you to exercise. I need you to exercise. But timing is everything. When you exercise intensely in the first hour after waking, you are stacking a massive additional demand on top of a system that is already running near capacity. Your heart, which is pumping thick blood through constricted vessels under elevated cortisol and adrenaline, is now asked to double or triple its output to supply working muscles. If there is any silent coronary disease, and again, this is present in nearly half of people over 60 without their knowledge, the coronary arteries may not be able to deliver enough oxygenated blood to meet the demand. Myocardial ischemia results. Dangerous arrhythmias can follow. This is why we see clusters of sudden cardiac deaths in gyms and on morning runs, particularly in people who considered themselves healthy and were doing what they believed was a healthy activity. If you want to exercise in the morning, wait at least 90 minutes to 2 hours after waking. Hydrate first. Eat something small. Warm up gradually and progressively. Never go from 0 to peak intensity in the first hour of your day. And the fifth behavior, the one that Margaret did every single morning, the one that I believe was the specific trigger that ended her life at 58 years old, is the one that shocked me most when I finally understood what it was doing. Before I tell you what it is, I need you to hit the like button on this video right now. Not because I need the engagement, because the person who needs to hear this fifth warning, the person who is doing it right now every single morning without any idea of the risk, will never see this video unless you help push it through the algorithm. Every like is a signal that this information matters. Every like is one more chance that this video reaches someone's mother, someone's father, someone who is on the exact trajectory Margaret was on. Please click the like button now. The fifth behavior is straining on the toilet immediately after waking. I know how that sounds. I know it is not the topic anyone expected me to end on, but I am telling you as a cardiologist with over 2 decades of clinical experience that this behavior, medically called the Valsalva maneuver, is one of the most consistent, most dangerous, and most under-discussed triggers of sudden cardiac events in older adults. Here is what happens. Many people, especially older adults, dealing with age-related changes in digestion, wake up and head directly to the bathroom. They sit down and they strain, sometimes for several minutes, sometimes with significant force. What straining does to your cardiovascular system is genuinely alarming. When you bear down forcefully, you increase intrathoracic pressure dramatically. This initially decreases blood return to the heart, causing a temporary drop in cardiac output. Then, when you release the strain, blood surges back into the heart all at once. Blood pressure can spike by 40 to 60 points in the moments after release. Heart rate can swing wildly. In a young cardiovascular system, this is absorbed easily. In a system over 55, especially one that is already dealing with morning cortisol, adrenaline, dehydration, and potentially thickened blood, this can be the final trigger. Autopsy studies of sudden cardiac deaths that occurred in bathrooms in the early morning hours consistently reveal this pattern. It has been documented for decades, but it is almost never discussed with patients because doctors are uncomfortable talking about bathroom habits, and patients are uncomfortable listening. So the warning simply does not happen. Margaret's husband told me that morning she had woken up, immediately gone to the bathroom, strained significantly for several minutes because she had been dealing with mild constipation for weeks and had not mentioned it to anyone, then stood up quickly to get ready for her appointment with me. She felt lightheaded as she stood. She sat back down. She said she felt a little strange, and then she got dressed, drove to my office, and collapsed 47 minutes later. The cascade had already started. The strain had already destabilized her rhythm. By the time she reached my waiting room, her heart was already in the process of failing. If she had known, if someone had told her, if any doctor in her life had ever explained the risk of morning straining to a 58-year-old woman with mild constipation and untreated borderline hypertension, she would still be alive today. That is why I am telling you now. If you are over 55, do not strain forcefully on the toilet, especially in the first hour after waking. If you are dealing with constipation, please talk to your doctor. This is not embarrassing. This is not trivial. This is a legitimate cardiovascular risk factor that deserves medical attention. Increase your fiber intake. Increase your hydration. Never force what your body is not ready to do. Give yourself time. And if you have any cardiovascular risk factors at all, discuss stool softeners or other interventions with your doctor. It is not weakness, it is intelligent risk management. Now, in the comments, I want you to be honest with me. How many of these 5 behaviors are you currently doing on a regular morning? Just write the number 1 through 5. I promise you, no judgment. I have been a cardiologist for 22 years, and I was doing 3 of these 5 behaviors myself until Margaret's death forced me to re-examine everything I thought I knew about morning safety. Before I share the specific morning protocol I now recommend to every patient over 55 in my practice, I need to be transparent with you. Everything I have shared is based on peer-reviewed cardiovascular research, decades of clinical practice, and careful case analysis. But it is not a substitute for personalized medical evaluation. If you have diagnosed heart disease, hypertension, diabetes, arrhythmia history, or if you take cardiovascular medications, please discuss any changes to your morning routine with your own physician before implementing them. Some of these changes can interact with medications like beta blockers, diuretics, or blood thinners in ways that require individualized adjustment. My job is to give you evidence-based information that starts important conversations. Your job is to bring that information to a doctor who knows your full medical picture. Here is the 5-minute morning protection protocol I now teach every one of my patients over 55. Minute 1. When your alarm goes off, do not move. Stay lying flat. Take 5 slow, deep breaths, inhaling through your nose for 4 seconds and exhaling through your mouth for 6 seconds. This signals your nervous system that there is no emergency and allows the morning cortisol surge to begin normalizing before you demand anything of your body. Minute 2. Sit up slowly on the edge of your bed. Do not stand. On your nightstand, which you have prepared the night before, is a glass of room temperature water, at least 400 milliliters. Drink all of it, slowly and completely. This immediately begins reversing the overnight hemoconcentration and reduces the workload on your heart significantly within just a few minutes. Minute 3. Remain seated on the edge of the bed. Rotate your ankles 10 times in each direction. Roll your shoulders. Gently turn your head side to side. These small movements activate the calf muscle pump that helps return blood to your heart against gravity and give your baroreceptors time to fully calibrate to your upright position. Minute 4. Stand up slowly. Pause for several seconds. If you feel any dizziness or lightheadedness at all, sit back down immediately and wait another full minute before trying again. If you feel stable, walk slowly, not briskly, toward the bathroom. Do not check your phone. Do not rush. Do not begin your day mentally yet. Just walk. Minute 5. When using the bathroom, do not strain. If your body is not ready, get up, drink more water, wait 20 minutes, and try again. Never force. After the bathroom, eat something small before you touch coffee. A banana, a piece of toast, a handful of nuts, anything that puts food in your stomach before caffeine enters your bloodstream. 5 minutes. That is the entire protocol. 5 minutes standing between you and the same fate that took Margaret from her husband, her children, and her grandchildren. 5 minutes that could add decades to your life. Now I need 3 things from you before you close this video. First, subscribe to this channel if you haven't already. Not for me, for the person you love who needs to hear this. YouTube's algorithm only pushes this content to the people who need it if enough viewers subscribe. Second, click the notification bell so you see the next video I make. I share evidence-based cardiovascular information that most doctors simply do not have time to explain in a 15-minute appointment. Third, and this is the most important thing you can do today, share this video with 3 people over 55 that you love, a parent, a spouse, a sibling, a friend. Because Margaret didn't die from bad genetics or bad luck. She died from information she never received, information that no one had ever thought to tell her. You can be the person who makes sure someone you love receives it. In the comments below, tell me which minute of the 5-minute protocol you are going to start with tomorrow morning. Research shows that publicly committing to a behavior change makes you 3 times more likely to actually follow through. So commit right now. Write it down. Tomorrow morning, when your alarm goes off, remember Margaret. Remember her husband sitting in that family room, asking me if there was anything she could have done differently. Remember that the answer was yes. Remember that the answer for you is still yes. Thank you for staying with me until the end of this video. Thank you for caring enough about your own life and the lives of the people you love to learn something that could genuinely save you. Respect your heart. Respect the decades it has worked for you without a single day of rest. And I will see you in the next video with more information that could change the trajectory of your life and the lives of the people who need you to keep living it.